Good morning. I'm Dr. Mary Dcruz from Calcutta, and I'm practicing as a physician and diabetologist. Today, I'm going to talk to you about understanding hypertension. So our today's discussion will be based on what is high blood pressure and how to prevent it. So generally, everybody has got a healthy blood pressure. It's a normal blood pressure, and most of us have normal blood pressure. But there are some people who will have a raised blood pressure. So what happens when there is hypertension? Whenever the heart is pumping blood, it is against some rigid or stiff arteries, and this gives rise to a high blood pressure. So normally in a person's daily schedule, the blood pressure is rising and falling, depending on what work they're doing, running around or moving. But when blood pressure remains high consistently over a period of time, it can damage your heart, your kidneys, and your brain. So in general, a persistent raise in blood pressure is called hypertension, and it happens over a period of time. It is because of unhealthy lifestyle, like having a sedentary lifestyle, having foods that are rich in salt and in oily and fatty foods, when you are smoking, when you have high levels of stress, and of course, alcohol consumption. There are other risk factors that can cause you to have hypertension, and you must take note of these so that if you have any of these high risk factors, the only way to know if you have high blood pressure is to get it checked. So age is a big factor. As people age, their arteries start stiffening and people develop high blood pressure. If you have a family history of high blood pressure, like your parents or your grandparents or close relatives, also, you should check your blood pressure if it is high. Excessive salt intake in foods like having too much of pickled foods or pappers or saturated foods that have got high salt content, you need to be careful. Also, not eating foods which have enough potassium can also cause you to have high blood pressure. Eating a lot of processed foods, that is packaged foods, causes blood pressure to rise. And one big factor which is not measurable is stress. All of us go through stress of unemployment, of unpaid salaries, of different problems. So moving on, does hypertension have any signs and symptoms? Really, blood pressure may have no signs and symptoms in most cases. In fact, it is called a silent killer because it does not cause you to have any problems. And the only problem may come when you have a heart attack or a cerebral stroke and paralysis on one side. So early and accurate diagnosis of blood pressure is very important. And for this, we need to remember that if you have any of the risk factors, then you need to check your blood pressure. So generally, there are no symptoms, but if symptoms are present, they are usually headache in the morning time, headache at the back of the neck, or you may have morning headaches, tiredness, vision problems, haziness of vision, or some ringing in the ears, buzzing in the ears, nausea or vomiting, or just plain fatigue. If you have any of these, you should get your blood pressure checked. Fortunately, blood pressure can be diagnosed easily by getting it checked. So a healthy blood pressure is 120 over 80. It is 120 systolic. It is the force with which the heart pumps the blood out. And the diastolic pressure is in between beats. When the heart is relaxed, you get a diastolic pressure. If the blood pressure is more than 140 over 90, it is called hypertension, and it needs to be treated with lifestyle measures as well as medication. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise of at least 30 minutes every day, eating a healthy diet, frequent meals, low in salt content, rich in potassium like fruits, quit smoking, reduce alcohol intake, regular blood pressure monitoring, stress management, and most importantly, if your physician has prescribed to you any medicines, they should be taken on a daily basis, not as and when you wish. You may tell the doctor you have some problems with the medicines, the doses will be reduced, but you have to take the medicines on a regular daily basis. So if blood pressure is successfully controlled with lifestyle measures and medicines, it might avoid or delay the use of even medicines. So let us look at these strategies. One is, like I said, regular physical exercise. And regular physical exercise is a drug-free approach to lowering high blood pressure. Regular exercise makes your heart stronger. And if you have a strong and healthy heart, it can pump more blood with less effect. So if the blood has to work less, the force on the blood vessels will be less and it will lower your blood pressure. In other cases, for physical exercise, you also reduce your weight and the major risk factors for high BP. So if the blood pressure is desirable at 120/80, then exercise can help to prevent it from rising with age also, thereby you prevent. So regular exercise can help you maintain a healthy weight, which in turn helps you to control your blood pressure. So you should aim for 30 minutes of any aerobic activities like structured exercise, brisk walking, jogging, swimming, or cycling. A healthy diet plays an extremely important role in controlling blood pressure, and a healthy diet with a high intake of raw vegetables, fruits, whole grains, and pulses with their skin covering is recommended for hypertensive patients. And for lowering blood pressure, you can also take a DASH diet or a Mediterranean diet, which is rich in olive oil, fruits, and vegetables. Eating less of saturated fats and total fats, getting plenty of potassium through food, and limiting the amount of sodium in the diet, and also limiting evening consumption of alcohol. Now, the DASH diet actually stands for a dietary approach to stop hypertension. So you look at foods that are rich in like fruits, vegetables, low dairy fat products, and go slow on saturated fats and cholesterol, which can help you to lower your blood pressure by up to 11 millimeters of mercury if you have high blood pressure. You can also reduce sodium in your diet. Even a small reduction in the sodium can improve your heart health by reducing blood pressure by 5 to 6 mm, which is a lot to see. So you need to read food labels, choose low sodium options, and you can reduce blood pressure by about 5 to 6 mm. Eat fewer processed foods like cheese and other foods like pickles and peppers. Don't add salt to your food. So basically, every day, a person in 24 hours can have 1 teaspoon of salt, which is about 2,300 milligrams of sodium in it. And avoid adding salt to food. Use things like lime and pepper to spice your food. Quitting smoking is extremely important. So it helps your blood pressure to come back to normal if you quit smoking, and this happens almost immediately. So it's one of the ways of preventing high blood pressure. You also need to monitor your blood pressure regularly, because if you do not monitor, you would not know what is your blood pressure. And some of the hypertensive patients actually check their blood pressure by visiting doctors, but it's not always possible to go to the physician. In that case, there are many blood pressure checking machines called sphygmomanometers available, and you can purchase any one of them and check your blood pressure at home. What I would suggest is not to check it standing. You need to sit at a table. The blood pressure instrument should be at your heart level, and that is when you check. And check it one time. Don't keep repeatedly checking, because electronic devices may confuse you. So one time, put the cuff properly and check your blood pressure. Then again, you have stress management, and this is an extremely important part of managing, preventing hypertension, because you need to learn how to meditate, how to let go, how to reduce your stress. This improves your emotional and physical health. You do not feel so stressed, you do not feel angry and restless. This lowers your blood pressure. So you could do something like listening to music, meditating, yoga, or anything that makes you feel calm. And last but not the least, you need to adhere to medicine. Like I said before, please take the medicines as advised by your physician. If you have problems, do consult him. He'll probably reduce your medicines or step them up if the blood pressure is not adequately controlled. Go back at the frequency the doctor calls you so that he can check if the medicines are working or they need to be changed. If your blood pressure is consistently above 140/90, even at home monitoring, you must go back to your physician. And lastly, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting to a healthy life early on can help you live a long and healthy life. High blood pressure, one of the silent killers, can be found out by checking your pressure and then by controlling it in the many ways that we have described as lifestyle measures, and keeping blood pressure in the normal range below 140/90 is very important to prevent cardiovascular complications, strokes, chronic kidney disease. So it is possible to maintain high blood pressure with regular monitoring and preventive care as mentioned. And if you need to take medicines, they need to be taken regularly every day. With that, I wind off, wishing you a healthy life.